Since 1993, the Robert Wood Johnson Foundation has distinguished leaders who work in their neighborhoods and communities to address some of the nation's most intractable healthcare problems. The Foundation's Community Health Leaders Program offers a unique opportunity to recognize innovative leaders. With courage, creativity, and commitment, they have overcome incredible odds to pursue strategies that improve the health and quality of life for men, women, and children in communities across the United States. This is about their stories, in their own voices.
My biggest fear at that moment, right after the earthquake, was because I was down the street, what was going on with the clinic. So I ran down the street as soon as I could. Most of the staff was gone, but most of our medical personnel had stayed. We had made a decision that night that if we could stay open for 24 hours, for at least the first 5 days, to figure out what we were going to do next. Husbands and wives that worked at the hospital, and we knew that the hospital was evacuating, but I couldn't do that without lights. While I was at the clinic, a fire truck came by and saw what we were doing and gave me a radio. I got on that radio and asked for a generator, and I asked for fuel, and I asked for extension cords, and it came like magic. So I just kept asking for things off the radio. Well, within the next 24 hours, I think they figured out who I was, and they came and took my radio away from me. But I got what I needed from them. And they felt bad later that they took away the most precious need that we had, which was supplies. But quickly, I can tell you that we didn't need the city after a while, because the community really came out and from all over the Bay Area to assist us in our adventure of trying to respond to thousands of people who were homeless. When I get lost in this bureaucracy, this is a very big bureaucracy, it doesn't take long for me to remember by walking out the door and figuring out who we're serving.
Since the award program's inception, the San Francisco Bay Area has been home to a cadre of Community Health Leadership Award recipients who have made extraordinary contributions to increasing access to quality health care and improving health outcomes at the community level. Barbara Garcia's political savvy transformed a small clinic serving farm workers and their families into a federally qualified multicultural health center that has responded to community crises, including the 1989 California earthquake. Marty Lynch's deeply held commitment to protect the rights and dignity of older adults has turned a tiny rented storefront clinic into a comprehensive health and social services agency. Re-entering the workforce as a school nurse, Janet Chang created innovative programs to improve access to health care for homeless students. She led a volunteer program to remove tattoos on youth seeking a fresh start from gang life. A Korean immigrant, Young Shin launched an advocacy and leadership development organization to empower Asian immigrant women to create healthier working conditions in Bay Area factories. Judith Rogers draws on her experience as an occupational therapist and disabled mother to provide home-based childbirth and parenting education for disabled parents. Inspired by her experience in the Peace Corps, Martha Ryan, a nurse practitioner, created a program in which formerly homeless mothers help provide prenatal care to other homeless women. Laura Lopez experienced firsthand the isolation and discrimination faced by low-wage immigrants. She leads the Street Level Health Project, which conducts outreach to connect uninsured day laborers to health and social services. These great leaders have forged their own critical pathways, consisting of rich family histories and key formative experiences, mentors and collaborators, accomplishments and breakthroughs, and challenges and lessons learned. Each leader is uniquely shaped by his or her life's course and experiences.
remember very well the day that I received the phone call. They're saying, okay, tomorrow you're leaving. You need to come. And it was like around 3 o'clock in the afternoon, and tomorrow is supposed to leave at 6 o'clock in the morning.
Very little notice.
Little notice, and without saying goodbye to nobody. I remember my mom, we went to pick it up, some passports, some stuff, and then we come back home, and a few family came, and God. I said Women's Choice Clinic was the beginning for me to see the women have a right, because I was feeling my part, and I don't have a right. I have to be. So working in the organization give me a lot of powers. Like I can do more. I can make some change. I can help somebody. I'm doing this not only for me, for others. So this is great.
My parents were really influential, because when you have a disabled child, you end up the attitudes of society and the expectations, but they had the expectation I could do anything. They never thought I couldn't. I went to college right when the free speech movement. Never thought about disability rights, never really gave it a name. But after a while, realizing how much they needed their rights, that made a huge thing.
Me being an immigrant woman, I experienced the firsthand that what it means being an immigrant woman in this country. I thought it was really important for everyone, especially the immigrant woman, to have a voice.
My parents instilled in us the importance of volunteering, and all my life I really have volunteered. I was fortunate that at a very early age I learned or felt how great it felt to be a volunteer, how giving was so much greater than receiving. Whenever I did something for somebody else, even at an early age, I realized that I got more out of it than I felt that the person that I was doing it for got. So, after completing nursing school, I started working at San Francisco General Hospital, and a year later, I found myself getting off a plane in Somalia, and I realized that I had made this happen. And for years growing up, I never really believed in myself, and that was an incredible life experience for me to recognize that I had decided that I wanted to do something in order to be able to get back to Africa, and here I had done it. And that has really been with me, and it has been part of my work in trying to get others to believe in themselves and understand the power that we all have within each of us if we just, if we believe that we can do it.
I think if I talked about roots, I'd have to go back to first to childhood. And the funny thing is, I'm not a religious person at all now, but I spent my youth essentially volunteering. I didn't think of it as volunteering at the time, but volunteering at the local Catholic parish. The local priest did a pretty good job of creating a little community out of those kids. And I was one of them, and it was probably the most fun thing I did as a kid. So if my parents were fairly heavy-duty Catholics, it fit right in for me. But that idea where there was definitely interest in community building and doing work that would help a community improve itself was present right there. And I guess I should thank my parents. Somehow I learned a little bit about progressive movements and Marxism, socialism, and some of the things going on around the world in a positive way, and then also got involved in some of the efforts to make our community and society here in the U.S. a little bit better place to live. So I think that had an influence.
One of the things I learned from the home was I met 3 sisters. They were nice to each other. So when I went back home, I was nicer to my sister. I should have been nicer before, but I was nicer to my sister. But when she passed, I had to step up. I had to be a nicer person because we had a gap in our family. She was a teacher, she was the daughter, she was the mother, she was everybody's friend. And I had to be a nicer person because I wasn't any of those things.
Started as a young person. I started working in a neighborhood center in Long Beach, California when I was 14. I began working as a assistant in the neighborhood center. From there, I worked from 14 to 21. Developed more of my skills and got more responsibility from the neighborhood center. That really kind of gave me a great opportunity to start looking at the types of careers that I could have. So worked in a food bank, so I got to experience the world of hunger in terms of families and how do you treat families in a respectful way and try to provide them with some basic needs like food. That time was the Chicano movement was going on, and so we had a lot of Chicano students from the local college, Cal State Long Beach, who began working at the neighborhood center, and they quickly took me under their wings to make sure I knew that I was going to go to college, which I had no understanding of what that was going to be about.
Each of us and each of them contribute to my work and my learning. They are not hesitant to tell me when I'm wrong either. And they haven't said that, but they have literally, each one of them have yanked my chain along the way. And that's okay, because I need to know whether this is not the right direction, or I'm stepping on someone's toes, or I need to take a step back, et cetera, et cetera. But we learn from each other.
She was more of a community person, but very sharp on understanding what community need was and how to respond to it. So Letha was the one who would teach me who needed to be listened to and how you needed to listen to them and how you showed respect. And, you know, in the community that we work in, you know, listening to people and respecting them for whatever their experiences is tremendously important. So she was sometimes she had to slap me up alongside the head, but she was, you know, tremendously supportive in me learning how to work with what became my community.
Because there are so many external challenges, so we still have to deal with, and you cannot just do it on your own. You have to work with others, and it takes time to continue to push for that, having a voice from the disenfranchised population like immigrant women.
Everybody, whether they have a disability or or they're elderly or they have some kind of a really serious problem, may have to come to us for care, and we want to be good, right? And we want to be there for them. So I'm proud of that. I'm happy about that. But there's no question that what gets more passion from me is the elder, disabled, homeless care. You know, I really like the fact that we're providing access to all these folks for good basic care.
When they walk in this door, it's like another world. They sit and they tell us everything. Yeah. Okay. They don't dread that visit to the doctor. They don't dread. They don't have that white coat anxiety. Yeah. That they feel confident. They feel that trust.
I was at Center for Independent Living way back when I was starting, and I was a new mother, and somebody called up and said, "There's no pregnancy book." And I go, "Well, I guess I will do it." I don't know. I never wrote. I was a lousy writer, really bad. But I thought, well, we have to go ahead and fill that gap. That gap is out there. It has to be filled.
When I see the critical mass women develop that leadership skills and knowledge and opportunity, that's where my energy comes from, and that's where my commitment to continue, because I want to see that every what people call disenfranchised population have skills and knowledge and opportunity to participate in the society. That will make this community and society healthy.
There were times that were, somewhat painful, that I had to just sort of keep moving forward because I was doing this for the program. I guess I love the work. I love working with the clients that we work with. And I see miracles happen all the time. And I think that that's certainly what has fueled me over the years.
We are always surrounded by crisis.
dealing with the crisis doesn't leave a lot of us time to devote that how we can think systematically and proactively.
Nonetheless, there is that burnout factor of there being more need and more things to be done in a community than what your organization can do, and you see the difference, and you work really hard to try to make up the difference, and you can never quite make it up.
That's the hardest part for me, is I'm not necessarily political. With every successful characteristic, there's also a price to pay. That I'm not necessarily the most popular person, because I say things out loud that most people would not say out loud. At the same time, I subscribe to the saying that says, I'd rather say things than regret not saying it. What I've learned along the way is how to say it in a little way that preserves everybody's pride. At the same time, if you're doing something wrong, you need to be accountable for it.
So I find that as a barrier to trying to understand, after all these years, those community dynamics and how to make things happen in a way that does work for folks who need to be your partners. And I haven't resolved that. I feel like that's just kind of stuff in community. I guess you struggle through that stuff, and do the best you can. Make the best decision you can given the information that you have.
How do you try to be accepted in the mainstream and still have to show that you still have to challenge the institutions in that way? I learned from greatly, because now as a county administrator, I'm right on the other side. But one of the things I kind of promised myself is that I would always treat the organizations that we fund in the manner that I wanted to be treated.
The leadership pathways of Bay Area community health leaders are truly unique and inspiring, and hold many lessons for future generations. From early childhood, the community health leaders were molded by experiences that created an unwavering commitment to underserved, vulnerable communities, which has defined their greatness and longevity. They inspire others to become part of a cause worthy of their commitment and teach others about authentic community engagement. The community health leaders emphasize that through deep relationships with communities, they can transform passion into compassion. Their humility, openness to learning, willingness to listen, and tireless devotion to their community's betterment truly define their greatness.